Ever wonder what the difference is between nurse retention, engagement, turnover, intention to stay, and intention to leave? Let's break it down. Firstly, nurse retention. This is all about how well an organization keeps its nursing staff over time. Think of it as a measure of how many nurses are choosing to stay with the organization rather than leaving. So when we talk about nurse retention, we're really discussing the stickiness of the organization, how well it holds on to its nurses. Next, we have nurse engagement. This speaks to how emotionally invested and committed nurses are to their work, organization, and profession. It's a gauge of the enthusiasm and dedication nurses have towards their roles. In essence, nurse engagement is about the heart and soul nurses put into their work. Then there's turnover. This is the rates at which nurses leave their positions within an organization. It's the flip side of retention. It measures how many nurses are exiting the organization. So when we talk about turnover, we're looking at the revolving door of the organization, how quickly nurses are leaving. On to intention to stay. This is the expressed desire of nurses to remain with their current organization for the foreseeable future. It's a measure of their commitment and willingness to keep working there. In a nutshell, intention to stay is about the future plans of the nurses, their desire to continue working in their current setting. Lastly, intention to leave. This is the expressed desire of nurses to leave their current organization and seek employment elsewhere. It's a measure of their dissatisfaction or lack of commitment to their current workplace. So, when we talk about intention to leave, we're discussing the potential exodus, the nurses' plans to move on. In summary, retention is about how many nurses are sticking around. Engagement is about the commitment and enthusiasm of nurses. Turnover is about the rate of nurses leaving. Intention to stay speaks to the future plans of nurses to continue working in their current organization. An intention to leave is about the nurses' plans to find greener pastures. Understanding these terms can help healthcare administrators strategize effectively to maintain a satisfied, committed nursing workforce. Remember, a happy nurse means a happy patient.